Get your smile ready for summer. Are you missing teeth? Do you have loose teeth? Can you bite into an apple? Is your smile ready to hit the beach this summer with confidence? We all work out and try to look great since we live in paradise. You need a smile to match. The South Florida Center for Periodontics and Implant Dentistry can help you replace those failing or missing teeth with a beautiful smile and the confidence you deserve. The doctors at the South Florida Center for Periodontics and Implant Dentistry have helped thousands of patients rejuvenate their smiles for nearly 30 years by replacing failing and missing teeth with dental implants. Often new teeth are replaced the very same day using the technique they pioneered more than 15 years ago. Teeth today. At the South Florida Center for Periodontics and Implant Dentistry, all of their doctors are board-certified dental specialists. They have placed thousands of dental implants. And we all know that experience matters. Call the South Florida Center for Periodontics and Implant Dentistry today to schedule your free consultation. Call them at 561-912-9993. You'll be glad you did. You are listening to the Ask the Experts show with host Steve-O. We will be right back with more experts in the field of legal, health, financial, and home improvement. Join us every Thursday from 5 to 6 p.m. Now, get ready for more Ask the Experts.
And we are back with more Ask the Experts. You know, our audience is a little older, more mature, and you know what? You want to look good. And our next guest, these guys absolutely can change your life. And I know from talking to friends of mine over the years, I want to introduce you to, and they've been on with us for almost a year now, Dr. Jeff Ganalis. This is South Florida Center for Periodontics and Implant Dentistry. And we're going to do something different than just implants today. That's like old stuff for them now. You are so far ahead of just dental implants. And I think you're going to be surprised, if you've never listened to the show before, what you can do now. And especially if you have gum disease. This is going to be a very important show. So, Jeff, for new people, tell everybody about your practice.
Thanks, Steve. It's really good to be here again.
I love when you're here. It's such an easy show to do.
Yeah, we just talk. Our practice is in Boca Raton. It was started in the early 60s. Obviously, none of the people who started it are still with us. But we are all periodontists. We're all board-certified periodontists.
Gum disease.
We treat gum disease, and our mission really is to save teeth. And if we can't save teeth, then we replace them. So we cover teeth, mostly in adults, but not exclusively, and then implants and everything in between. So we're really focused and specialized on what we do. And I'm sure a lot of your listeners have bleeding gums.
Yes.
And I have to tell you.
That's one sign that
that's it.
You've
That's
got
the most
gum
common
disease.
one. And maybe if you think
Breath.
about it, you got a couple of loose teeth too. And maybe someone's told you your breath isn't so
Yes.
fresh anymore.
What do people think when, like, their teeth become loose? What do they think? They're going to all of a sudden stop being loose?
Well, you go into denial. And then you also do a little research on the internet, and you start looking at reviews. And an awful lot of the reviews on the internet, whether they are real or not, doesn't matter. They're there. It's information in your face. And people talk about how they suffered and how expensive it was and how they felt terrible afterwards. Well, that's not us, and that's not what we do. We have lots of different methods of treating gum problems, periodontal disease, gum disease, that don't hurt, that don't cost a fortune, that don't give you big black spaces between your teeth, and they work. And if you look at our reviews, for instance, Google us at flsmile.com and read some of the reviews there. They're off the charts on a consistent basis because we are who we say we are. We
Exactly.
do what we say we can do.
I want to say, because we're a 50,000 watt station. We go all the way down Aventura. People in Orlando actually hear this show. I'm going to tell you something. something like this, you don't want to go to whoever's closest to you. And that's what's so great about it. We're giving you somebody. You don't have to Google someone. You need someone who really understands this, and this is all you do.
Yeah, as I said, we're all board certified, and there are now 10 certified specialties in dentistry. Lots of people can advertise they specialize in cosmetic dentistry or implant dentistry. Those are not certified specialties. Periodontics and implant surgery is a specialty. We all went for at least 3 years of additional training to do that. We've been training ever since.
You've done fellowships.
We've done fellowships, residencies, and we're diplomats of various boards and belong to organizations, and we're continuing education junkies. We go to every course. We have every piece of technology. We do this because we're serious about it.
Average age of your patients?
And they range anywhere from the 30s up to the 90s.
So you wouldn't think somebody in their 30s could get, gum disease.
As a matter of fact, latest estimate was done by the federal government, by CDC, and almost 50% of Americans, of adults in America, have some degree of gum disease. 50%.
Is it hereditary?
Can be.
Okay.
So if your parents had it, you're more likely to have it. On the other hand, it's not a curse either. It doesn't mean that you have to have it. And that's where jumping on early and getting thorough
What does that mean? Because you try to save teeth also. So if all of a sudden you develop gum disease, can you prevent from the teeth falling out?
Absolutely.
Okay.
And it's all about getting in early, diagnosing the problem, and going through the specific correct treatment to address it. Sometimes it requires laser treatment. Sometimes we need antibiotics. Sometimes we need just a deep cleaning. Sometimes it requires a surgical procedure. Sometimes we can rebuild the bone, regenerate what's been lost.
How do you know what's under the gum?
We take x-rays. We have all sorts of instruments. And we have a very special instrument called a dental endoscope. You know what an endoscope is? If you look in the stomach, or you do arthroscopic surgery, they look inside the joint. Well, we have one where we can look inside pockets, inside the cuff of the gum around each tooth. And there aren't many of those in South Florida. For a long time, there were 3 of them in all of South Florida, and we own 2. Now there's probably a few more, but we still have 3 out of probably half a dozen. And we use that to do 2 things. We can diagnose problems with it very accurately and specifically, but we can also do these really minimally invasive procedures so that you heal better, you heal faster, you have no downtime, and it doesn't hurt.
I think what's amazing is people maybe have gone to someone who really didn't quite know what they were doing, and they said, you don't have enough bone. Well, that just, for you, that's like no big deal because you deal with that every day.
That almost doesn't exist. I may see one person every 2 or 3 years that I can't handle because there's not enough bone. And frankly, there are some super specialized practices that can handle someone like that if you need an implant.
But that shouldn't be an excuse.
That's extremely rare. It's not impossible.
If they told you that, see, you've got to call. You've got to call your office. Give everybody your phone number.
We're at 561-912-9993.
And let's talk more about experience because there's not a lot of offices in South Florida that can compete with you when it comes to experience.
Now,
you can brag now.
I can brag. Well, I can tell you that
I was shocked that people go back to work. If they have it done on Friday, they're back to work on Monday?
That's usually what happens is we don't, or we set up procedures so that patients get back to their lives really fast. And it's very common to have something done on a Thursday and go back to work on Friday. If it's a really big procedure, if you're doing a whole mouth or either an upper jaw or lower jaw, then there may be a little bit more time, but you're certainly back in your life by Monday. if you do it on a
I
Friday.
think the greatest thing is that people who would go in missing teeth, had to have extractions done, might have to wait a week or two, 3 weeks in to get a mouthful of teeth again. They could actually walk out with a mouthful of teeth in one day with you.
Actually, you're a little off. The
30
typical,
minutes.
the typical story that I hear when I see someone for a second opinion is I was told I couldn't have teeth for 3 months.
So you,
Or 6
I'm way
months.
off.
Not 3 weeks or 4 weeks, but 3 months is a typical waiting period before you get teeth on implants. Well, more often than not, 80, 90% of the time, we put teeth on the same day.
I mean, that's amazing.
Yes. There are times where we can't, and times where it doesn't
but-
make any...
And everybody's different.
There are times where it doesn't really benefit you. If it's a back tooth, who cares?
Right.
But if it's your front tooth, you are not going to walk around with a flipper or something kind of removable type of denture to replace that tooth. You can't speak with it. It messes up your taste.
Food tastes different.
Food tastes different. You get self-conscious. They move around. You don't want to really speak. You don't want to go out to a restaurant. We don't do that. We get these implants working faster because we know what we're doing and we have the technology and all of the right criteria to make sure we
You
get them
have
right.
the most up-to-date equipment. I mean, you were just explaining about, I mean, a lot of dentists wouldn't even carry that at all.
No, most
They
don't.
just wouldn't. So the equipment, the technology, you're like, they're at the top. And like you said, you're board certified. And let me tell you something. We have other doctors on the show who are board certified. It is a huge difference when you're board certified. First of all, you can say you're an expert.
Yeah.
And if you're not a board certified, you're not really even allowed legally to say that. How many dentists do you have in the office?
We have we have 4 periodontists. All of us are board certified periodontists. 3 of us are full time, and 1 splits his time between our office and he's got another office at Aventura. And we also have a board certified anesthesiologist who comes in. So there are really 5 of us all together, and all of us again have met that criteria to say we are board certified, and we take what we do very seriously.
Especially women, do they know that when they smile and they're missing some teeth, it's so much different when you have those teeth put in the smile? Do they realize they smile different? They've got more confidence?
It's hard to say. I have to believe that
'Cause
if you're
I've seen
missing
it.
teeth, or they're crooked, or they're out of position, or they're overlapped or discolored, I have to believe in the back of your mind you know that that's going
Okay.
on. I think that most people don't confront that every day. I think a lot of them don't look in the mirror all that carefully. I think they don't brush their teeth with their glasses on. But it's been shown that if you don't have a good smile, first of all, you have fewer friends. You don't interact as well in social conditions. You make less money. You don't get promoted.
I understand what you're
you
saying.
don't get hired for a new job. When your smile's not good,
You've got that confidence when
people
you...
shy away from you.
Yeah.
There's an aversion to someone that has a great smile.
And I got to
a bad
say
smile.
something. I think this is a good comparison. I've had a lot of friends of mine, female friends of mine, who wanted plastic surgery done. It seems like the one who went to either the closest or the cheapest are the ones that had all the problems. The ones that went out and said, I want to find the best. So if it's 30 miles from here, I'm going to go 30 miles from here. I don't care. I don't care if they're more
for you. And that's one of the things we also spend a lot of time on is making sure we understand you, what's wrong, and what it's going to be. We're not going to throw a lot of unnecessary charges on, and I see that all the time, where we charge for an extra bone graft, an extra gum graft, some kind of extra analysis that doesn't make any sense. We don't do that. We don't play around with the numbers. We tell you what it's going to be, and then we perform on it. And frankly, If it turns out to be more than we expected, we generally eat the difference because we figure it's our fault for not anticipating that in the first place. Imagine if you went in, took your car in to a mechanic, and you expected to do brakes, but they also threw on rear brakes and they didn't charge you for it. That doesn't happen. It does with us.
Wow. We're going to go to break. When we come back, I want you to explain to people why they should come to you.
Sure.
Why? We're here with, this is, I think, one of the best periodontists in all South Florida. Give people your phone number and we're going to go to break.
We're at 561-912-9993.
We'll be right back.
Get your smile ready for summer. Are you missing teeth? Do you have loose teeth? Can you bite into an apple? Is your smile ready to hit the beach this summer with confidence? We all work out and try to look great since we live in paradise. You need a smile to match. The South Florida Center for Periodontics and Implant Dentistry can help you replace those failing or missing teeth with a beautiful smile and the confidence you deserve. The doctors at the South Florida Center for Periodontics and Implant Dentistry have helped thousands of patients rejuvenate their smiles for nearly 30 years by replacing failing and missing teeth with dental implants. Often new teeth are replaced the very same day using the technique they pioneered more than 15 years ago. Teeth today. At the South Florida Center for Periodontics and Implant Dentistry, all of their doctors are board-certified dental specialists. They have placed thousands of dental implants, and we all know that experience matters. Call the South Florida Center for Periodontics and Implant Dentistry today to schedule your free consultation. Call them at 561-912-9993. You'll be glad you did.
Hey, we are back. We are with Dr. Jeff Canales. Did I pronounce that right?
Canales.
Yeah, because I always just call you Dr. Jeff. Anyway, you have, I think, one of the greatest practices here in South Florida, and I feel someone right now in Aventura is thinking about having this done, and they're going, oh, I don't want to go all the way out to Palm Beach. But I'm telling you, this is not where you want to go, whoever's the closest. This is not, you don't want, your teeth are so important. You want to go someone that you don't have to worry about. If they say this is what you need and this is how we're going to do it, you know it's right. And I've seen all different sides. And I've always told Jeff, I said, you should have been a college professor with this because you explain everything. You don't talk over anyone's head. What I love about your practice is the first thing you said, you want to save teeth. And if you can't save them, and you've probably done everything you could, then the next step. And I think teeth in a day is just incredible. I mean, what are they going to come out with next?
That's a good question. What's next? Obviously, it gets a little bit better all
Yeah,
the
but
time.
you guys know what's next.
We know what's next, and what's next is really exciting because it means that we're going to be able to do this for more and more people. As it is, we can do it for about 80-90% of the people, of our patients that come in and need to get it done.
And is it usually the bone, not enough bone to work with?
It's not enough. It's someone who maybe have some other illness, diabetics, something like that, where they may not heal so quickly. But the advancements that are coming that make everything more predictable all the time. And I've said earlier, we like to individualize treatment. And we are going to look at your health. We're going to look at
someone
your
asked
bone
me before the
structure.
show, what if you're a smoker? Can you still have...
Yes, you can.
You can.
You can.
Even if you don't have to stop smoking for a while.
No, I mean, there are
Okay.
lots of good reasons to stop smoking.
Well, she went to a plastic surgeon, and what she was looking for is, they said, you're going to have to stop smoking, or we can't do the surgery. So she wanted to know about, this woman wants everything done.
Yeah, I actually think that's silly advice because we know smokers will heal, but they will have more complications.
Okay.
If you want to do the procedure and accept the risk for more complications and also recognize that things may fail later on because you're a smoker, then you're entitled to make that decision. You also are at risk for heart disease, lung disease, and a dozen other ailments And most people know that. So I
Do you
think
have a cutoff age-wise that you don't like to do anybody older than
105
70?
about.
Oh, okay.
That's
That
probably our that may be a cutoff. Our record in the office actually is about 102. And she got
I
teeth
remember.
today. And she went back to work right after that. And that's what kept her young. So if you're healthy enough to have a tooth extracted, you're healthy enough to have a tooth replaced. That's how
do
we
you
look
do the
at it.
extractions in your office?
Of course.
Okay.
Yes. It's all part of the whole process.
So you could come in early in the morning and maybe have your teeth extracted and maybe leave late that afternoon?
It's not even that late. If you were doing a full mouth, you would come in around 8 and you would leave around 2.
So if I have it done on a Monday, when can I go back to work?
If you're doing a full mouth, you may want to delay until Thursday, Friday, or the following Monday.
Okay.
But if you're doing just either a full upper or a full lower, 2 days later, you're
Okay.
pretty good. And
1
if
to
it's
10
just
on pain. Everybody wants to know how
4,
painful. That's not bad.
4 to 6, depends on how your reaction is, and also what we can give you. Certain medications prevent us from giving you, say, anti-inflammatories. But we're also big on some of the natural products as well.
Okay.
Arnica, bromelain,
these-
quercetin. These are all, we are now distributing them as part of our regimen
You
to
should.
help people heal faster and feel better. And it cuts down on the pain, it cuts down on the inflammation, it cuts down on the bruising. And they're really compatible with everything else that we're giving you to. So it's all positive.
Some things I already know the answer to, but I know someone's thinking about when can I eat real food?
You can eat real soft food immediately.
Okay.
And that means that we try to limit people from eating stuff that's crunchy, that's tough. We're not going to allow you to eat bagels, carrots.
I heard bagels are the
apples.
worst.
They're bad because they cause you to put a lot of stress on your teeth. You got to hold off on those kinds of foods for probably 6 or 8 weeks. Not months, but weeks. On the other hand, anything that you can cut with a fork, you can pretty much have immediately. And, that includes a burger, chicken, fish, pasta,
Wow.
vegetables that are steamed, chopped salad, things like that. You can have immediately. Because
What about follow-up, cleaning? When you have, say, a whole upper, you still come in,
Absolutely.
have your teeth, because you still got to take care of the gums.
Got to take care of the gums because the implants are held in the bone. And then the teeth go emerge through the gum, but they're attached to the
Okay.
implants underneath. That seam, that junction between the tooth and the gum is vulnerable. It has to be cleaned, it has to be checked, it has to be maintained. Because if there are problems later on, that's where that problem's going to start.
Okay.
Just like the gums around teeth.
So
It's
regular
just as
teeth,
important.
you usually go in every 6 months?
3
What
to
about
6
if you-
months,
okay,
depending
so if you
on
have gum disease, how often do you come in?
if you have real periodontal disease, gum disease, you probably ought to be seen every 3 months.
Okay.
And
I don't even know if people knew that. I don't even know if some
may not.
people out there even realize they have gum disease.
well, if your gums bleed, they shouldn't. And
That's a good way to put it.
it's as simple as that. And inflammation is the reason your gums bleed. The inflammation in your mouth is caused by bacteria. That same inflammation travels throughout your body. It causes atherosclerosis, or hardening of the arteries. It causes erectile dysfunction. It causes arthritis.
Wow.
It's associated with different kinds of cancers, like pancreatic cancer and some of the colon cancers. All of these
That's amazing.
things are connected.
All because of gum disease.
Periodontal disease, gum disease, is related to 53 different disorders in the body.
Can you ever get totally rid of it?
You can control it, and you can eliminate the signs of it.
Okay.
You may never eliminate your susceptibility to it, just like you may always be susceptible to catch the flu. Doesn't
Right.
mean you're going to. But you can definitely control and stop gum disease once it gets started.
So we've got about 3 minutes. Tell someone out there who's listening, they're going, God, God, should I do this? Tell them why they should come to you.
You should come
And
to
pat
us.
yourself on the back.
You should come to us because we pride ourselves on integrity. We really take what we do seriously, and we want to make sure that our patients have positive experiences, and frankly, that they share that information. They send it to other people. And we get results. We get long-lasting results.
That's why you've been around for so long.
That's why we've been around. That's why we're growing. That's why we have so many doctors. And we have the best facility there is. We have the only robot in South Florida for implant placement. We have some of the other only technologies, or we were the first to get them. That one of the first to get the 3D imaging technology 13 years ago. Some people are just getting it now. We have bite analysis. We have methods to determine when to load an implant or when to use an implant. We take photos. We are just constantly evolving all the time. And we get things done quickly, efficiently, and as painlessly as possible.
God,
And we're a good value on top of that.
Listen, I love having you on, and you'll be back again next month. Listen, give them a call. Give everybody your number again.
We're at 561-912-9993.
And you know what? We didn't say this. You've got a great website. What is your website address?
www.flsmile.com.
So much great information on there. And you know what? Go in there, make an appointment, sit down with them, and let them tell you what they can do for you. You can't, everybody is different. So you're hearing, he's kind of talking to everybody at one time. Thanks for tuning in today. We'll be back next week with more Ask the Experts. Thanks, Doc.
Thank you, Steve.
We'll see you guys next week.
Thanks for listening to the Ask the Expert Show, featuring interviews with local experts in the fields of legal, health, financial, and home improvement. Call our office at 888-574-6999 to become one of our experts on the show. And tune in again next week for more Ask the Experts with Steve-O. The opinions expressed